Everyone should have something that makes them happy and feel alive like I do. I started to feel a numbness in my left arm, and I could not use my arm or hand. I started to feel dizzy, and I sat down and called 911.
So she had what's called acute aortic dissection. What happens with a dissection is the blood actually tears a hole in the inside, the inner lining of the aortic wall, and dissects into the layers of the wall. That's why it's called a dissection. And depending on where in the aorta that happens, it's a life-threatening emergency, sometimes requiring emergency surgery to fix it.
The paramedics checked me out. They took me to the nearest hospital. There happened to be a surgeon there. I remember him coming back saying, "You need emergency open heart surgery."
So they took her to the closest hospital, which was not the University of Utah. They made the diagnosis, and this hospital fortunately has heart surgeons, and so they were able to do the emergency surgery at that hospital without having to transfer her anywhere else.
I came home, I was released from the hospital, and I couldn't eat anything. I couldn't even keep water down. The local church, there were people sent. One of the members of the church was in the medical field, and he wanted me to go to the emergency because I was not doing well. If I'm going to go back, said it has to be U of U.
So Kim was referred to me by our cardiology group, and when she got to me, we did some CAT scan imaging, so looking at her aorta, and we see this very commonly, that after surviving the acute aortic dissection with the surgical repair, which she did, that you move into the chronic phase where the dissection is still there, and we have certain things that we look for that are more concerning features. And because she's such a young, active person, we wanted to be aggressive, because anyone who has a chronic dissection like she did is at risk for future aortic complications.
That first one was the first surgery that I've ever had. This one was like the first successful surgery that I ever had. I started skating at the age of 4, and I started competing at the age of 9. I thought I would never, ever skate again. When I stepped on that ice, I felt young again, renewed, like a second chance. I felt free. Just to feel that ice underneath my blades and that cool air, like I remember growing up as a child. I felt alive.
That's why we do this. I think that we were very focused on survival and mortality rates and getting people through surgery, but that's not the most important thing for patients. I think that what people really want is to get back to their life. And when you can see a patient who clearly has a passion for an activity like that, to get back to it is just awesome for us.
I feel that I moved here from California 8 years ago for a reason. I came here and I was here for my life to be saved by University of Utah.